Hello everybody. First of all, to say thank you all for coming. Thank you to Andy for chairing the conference. As chair of our clinical panel, he does this for us with great regularity. I'm very grateful for that. I know some of you have travelled some distance to be here at this conference today, so thank you. And thank you also to our sponsors who are helping us to make this meeting possible. I'm going to talk to you, some of this talk will be familiar to some of you, but it really is important for me that I give you an update of the work that we've been doing within the Anaphylaxis campaign over the last, since we had the last corporate professionals conference. So, what I'm going to talk about this morning, I'm going to tell you what we do, and as I say, that will be familiar to many of you in the room and how we do it. Talk about our latest activities, and we've been beavering away over the last few months, so it's great to be able to update you all, and then talk a little bit more about how we want to continue working with yourselves. So, what do we do? And as I say, this will be familiar to an awful lot of you in the room, but it always bears repeating. We are the only UK charity operating solely for people who are at risk of severe allergies. That's our focus, and that will continue to be our focus. We receive no government funding whatsoever. We have no commercial activity apart from selling some of our training courses, so we don't sponsor products or anything of that type. So the bottom line is that we are dependent to keep ourselves going on members, fundraising and donations, and our membership system is divided into three groups, as you probably know. We have individual members, we have healthcare professionals like yourselves, and corporate members, and I'll talk a bit more about that later on. Basically, our fundamental premise is to provide information and support to all those who are at risk of severe allergies and their carers and their families. We're a patient advocate, so we actually will, if people contact us and there's a particular issue around food labelling or around getting access to service or whatever, we will actually talk through the issues with individuals and help them to move forward. We're an educator, so we have our allergy-wise training programs, which I'll talk about later, and we're also a campaigner. The Anaphylaxis campaign started just over 20 years ago by David Redding because his young daughter went into a retailer's cafe and ate something with nuts in when she was told it didn't contain nuts. She died. David happened to be a journalist, and with the help of other parents and also by lobbying Parliament and other people, he managed to establish the Anaphylaxis campaign charity. So we started as a campaign, and over the last few years, with the support of the Board of Trustees, and some of our trustees are in the room at the moment, we decided we would go back to being a campaigning organisation, and that's something we've taken forward, and I'll talk about that a little bit later. So this is my staff. Those in the room will hate this, who are my staff. They don't like me putting this picture up, but I think it's great to show that these are the faces behind the team. We are small but beautifully formed. I always say that, just like me. So we have a staff of 15, 11 whole-time equivalents. We're very female, and we're of an age, I think, largely. However, we do have another man who isn't up there, who works with us now 2 days a week, Bob, who does our corporate relations. But David, as you can see, still comes in over 1 day a week, and writes our information, a lot of our information sources. So that's our team, and Moira, Lisa and Joe are in the room at the moment helping to run this conference. So, talking a bit about our membership, we've got 4,500 individual members. At its peak, the Anaphylaxis campaign had over 8,000 members, and individual membership is subject to attrition. That's because over the last few years, people can source information via the internet and various other sources. So for charities like ours, and was set up to give information in a particular way, people don't find it quite so necessary to join organisations. Also, we've taken the view that virtually all our information is freely available on our homepage, so you don't have to be a member to access it, and that was a very important decision for us. 77% of our members are parents. That won't come as a surprise because a lot of parents, when their child is newly diagnosed with severe allergies, we're a port of call because the clinics will refer the parents to us. 25% are adults, and this proportion is growing. We're seeing more and more late onset allergy, and also more adults are increasingly turning to us for support. There's not lots and lots of paediatric allergy services across the UK. We'd like more. But adult services are particularly sparse, particularly in certain parts of the country. And increasingly, we are finding that those adults are turning to us. So that's a shift for us. Most of our members are affected by food allergy, primarily peanut, but we cover all severe allergies, so be it venom, be it latex, drugs, idiopathic, exercise, whatever. We have members who are allergic to all of those different sorts of areas. So what do? We have our communications on and offline. We have the helpline that runs 9 to 5, 5 days a week, headed up by Moira, supported by Lisa, who are both in the room today. They get a lot of queries by phone, but increasingly queries are coming through Twitter, through Facebook, and through email. So we're seeing a change in the types of queries, and Moira and Lisa both tell me that the queries are getting increasingly complex as well, because a lot of straightforward information is now so much more readily available. We run support groups. A couple of years ago, we used to run workshops, and we employed trainers to run those workshops. We ran about 10 a year, I think. And we were finding increasingly that people were not coming along to those workshops. So we asked our members, what do you really want? And they said they just wanted support from other people who were actually in the same position as themselves. At that stage, we had a handful of support groups. We employed somebody, Debbie, to look after volunteers and also our support groups. And we now have 46, and the number is growing exponentially. We're particularly pleased when we have clinics in parts, support groups in parts of the country where it's not easy to access NHS services, and we often put calls out to members to say, would you like to run a support group? And we give them training. We bring them all together once a year in Reading for some stay overnight if they come from a distance, and we get a sponsored event for them, and we give them training, and they have access to Debbie, who gives them support as well. We don't let anybody run a support group, but we have a very, very good team at the moment of 46 volunteers who do so, and that's absolutely fantastic. They meet in people's homes, in church halls. Some of them meet in their local clinics, and increasingly medics and clinicians from the local clinical centres are going out and attending support group meetings to give talks and information. That's fantastic. So we're very proud of that. Then we've got our Meet the Medic events. Again, this is a new departure for us, and we piloted them last year, and we're very pleased with how they developed. So this year we're having 2 more. We had one in Salisbury, which was incredibly well attended, and we had a local paediatrician and an adult allergist come along, and it was largely question and answer as opposed to formal presentations. The meetings overran. They're in the evening, and we had a largish audience and very mixed. Adults, parents, and a lot of parents of older children, parents of 16 and 17-year-olds who were increasingly worried about what's going to happen when their child moves on from paediatric services. We've got another one coming up in a couple of weeks in Leicester. And what we're developing now is to have Meet the Medic events via webinar. So we're planning 2 of those for the end of the year. Bit nervous about it because we've not done this before. And one will be on latex, because the latex allergy support group merged with us at the end of last year. So we've got a lot of members who are allergic to latex. So we're going to do a special thing for them. And the other one will be for adults. And this is very much an experiment, but if it works, we will carry on and do more events in this way. We have our product alerts, where if something happens with a company, wrong packaging or wrong ingredient or whatever, we send out product alerts specifically to those who are affected. So we don't send blanket alerts out to all our members, and our members appreciate that. And then working with the allergy clinics. Just over a year ago, with the agreement of the trustees, because it was very time consuming, it was arranged that I would ring every single lead clinician of every allergy clinic across the UK, going through the BSACI website. I made the last one on Tuesday of this week, to a clinician in Wye Valley. You can see I did it alphabetically. He's WY. He was a respiratory clinician running an adult clinic. He'd gone down and did further qualifications in London, because though he was a respiratory clinician, he was the only person who could deal with allergy referrals, and that service is now developing. So I've had conversations from the biggest to the most isolated to the smallest, and it's been a fantastic exercise. I thought it'd take me a year. It's actually taken me, to the end of this month, so to the end of April, May, so a lot longer than I thought it would take. Our database now is second to none, and they've all got my personal email and I've got theirs. So it's been a very, very good exercise. So just a bit about our volunteers. When I started with the campaign nearly 8 years ago, we had hundreds of volunteers, but when we worked through the list, some of them didn't even know they were volunteers. They certainly weren't volunteers in the sense that I think most of us think of volunteers. They were a name on a list. Now we know we have 370 volunteers. They're on a database. They indicate the sort of work they'd like to do for us. So some of them help us at events, some of them do other things for us. They act as case studies, they'll do media stuff, all sorts of things. And those 370 volunteers are absolutely vital to us to cover our work across the UK. We've got 153 live volunteers. The others aren't dead. What that means is that they're people who go into their local GP surgeries, they go into clinics, they check our leaflets are there, they see if there's outlooks there, they just have a sort of relationship with the clinic staff, which is great, and that number's steadily growing. As I mentioned, we've got 46 support groups. We've just got to call out, because we're desperate to get a support group in Lincoln. But because there's quite a vast area there which is not covered, and we're waiting for people to come forward. But these are growing exponentially. And if you go on our website, there's a map which shows where all the clinics are, the support groups are, and when the next meetings are taking place. Working with clinicians like yourselves, absolutely vital. We don't have a big research pot. Would that we did. You know, I work very closely with the Chief Exec of Asthma UK, and I'm so jealous of their research pot, but it would be great. But we don't have that. But we do facilitate research. We have a small grant scheme, and Dr. Rebecca Nibb, who's going to talk later today, who's one of our trustees, she manages that for us, and we have about £5,000 where we have special grants to work with dietitians, and that's a new innovation for us, and £5,000 to help people who are doing masters or PhDs or special allergy courses who need that extra bit of help, and that's all accessible through our website. We're part of IFAM, the €9 million project looking at allergy across Europe. There are 3 patient support groups involved, Germany, Ireland and ourselves. That's very, very demanding work, but fantastic to be involved at that level. And I mentioned we do projects with allergy clinics as well. A number of clinics just approach us and say, we're doing this study, or can you comment on our documents, or all sorts of different ways. And we've always got quite a number of projects of that type taking place at any one time. We have our clinical and scientific panel, and Andy's here, and he chairs that panel for us, which is fantastic. And Dr. Trevor Brown is vice chair. We've got 20 of the top specialists in the country who are part of that. We've got GPs, secondary care clinicians, we have a consultant pharmacist, we have dietitians. Absolutely fantastic, and Dr. Paul Williams is here today. He's also part of our clinical and scientific panel. And they only meet face-to-face once a year, and it's pretty difficult to arrange that because they are the top people. However, I bother them with monotonous regularity, asking them to review documents or to just for their opinions on things. And not one piece of information leaves the Anaphylaxis campaign that is not clinically based. So you can have absolute confidence in that. I have a marvellous staff, but we can't make it up. So we actually work very closely with these clinicians. We've got over 700 professional members. When I think back to about 5 years ago, when we had two professional members, and we set up the scheme, and it's grown exponentially, it continues to grow. That's absolutely fantastic. And there are all sorts of byproducts of that. So if I'm talking to charitable trusts or grant-giving bodies or whatever, and I say, we have 700 clinical members, and they pay to join us. We don't just give membership out. That is quite impressive. So that's great. We have our training programs, allergy-wise. We've got one for GPs and practice nurses, which is given free to GPs in Scotland, because it's paid for by the Scottish Government. We sell the others for a very reasonable price, but as you can imagine, we don't get a huge take-up across the rest of the UK, and primarily it's independent GPs that do purchase that course. We've got the one for nurses, which covers district nurses, health visitors, allergy nurses. That sells very, very well, and some of the CRGs across the UK bulk buy it, which is brilliant. And then we've got one for individuals, which is now free. Anyone who joins the Anaphylaxis campaign as an individual member will get our course, our online course, free. That was a decision that we made a couple of months ago. And we have a course for pharmacists, which was developed with Boots, supported with sponsorship from ALK. And Boots use it for all their pharmacists, and I think they have about 20% of the prescriptions in the country go through Boots. So the remainder, we have this course for pharmacists, which is free to every pharmacist who becomes a professional member. So that's just started. So we're hoping that will take off. I mentioned the project with the allergy clinics, and we also work closely with the BSACI, with the European body, IACI, with the British Society of Immunologists, the Dermatology Association and the Dietitians Association. Working with corporate members, extremely important to us. We've 146 corporate members, all the major retailers, food manufacturers, catering chains, and the research bodies are all corporate members of the Anaphylaxis campaign. We work closely with the pharmaceutical companies, particularly the adrenaline distributors, but other pharmaceutical companies as well. And we have a corporate membership scheme where they have conferences and fact sheets and e-newsletters. They work with us on product alerts. We work closely with them. We have meetings with companies where we talk about, if they're retailers, labelling issues, if they're manufacturers, about other issues with regard to food manufacturing. So we work very closely with them. We help them respond to the EU regulations. As you know, the law changed in December 2014. We work with them on thresholds and reference doses, and we now have a food industry panel. Such was the success of the clinical panel that we decided to replicate it with the food industry. And it's met twice. It's about to meet the third time. I thought it would only meet every 6 months, but they're very keen to keep meeting. We have very senior people across the spectrum from the food industry, and that is proving absolutely invaluable. So we're part of the National Allergy Strategy Group, which campaigns for more allergy services, and we work with Allergy UK, the BSACI, the BSI and industry partners as part of that group. We meet with government departments, the Department of Health, Department of Education, and also the MHRA. We're a member of government working groups. One of our staff, Mandy East, is very involved with all of the development of the NICE guidelines and standards, so that's really good. And we work with other charities, both nationally and internationally, and I'm on the patient support group body for IACI, the European Allergy and Clinical Immunology Group, which is fantastic. And I'm also part of the committee for IFAR, which is a group of 30 countries. It's managed through support from the USA, and we meet once a year. We share ideas, and there's always a lot to learn. I mean, certainly we have learned a lot from countries like Canada, Australia, New Zealand, North America, the USA. But in addition to that, we have members from Chile, from China, from India, from Argentina, and some of those countries don't have access to adrenaline, and we help those countries to lobby their governments and also to help them to set up their patient support groups. So that's a really satisfying part of our work. That just gives you, these are big numbers. They about the number of people last year who used our online communications, which is great. And our fact sheets, where I go out and about a lot to clinics and network meetings, and I always say to them, don't reinvent the wheel. Use our fact sheets because they are the best. They're clinically reviewed by members of our clinical panel. We have the information standard, which means they have to be reviewed every 2 years. They have to be fully referenced. They're fantastic. They are the best, and they're freely downloadable from the homepage of our website. So why anyone would want to develop their own is beyond me. They really are fantastic. So, you know, we try to encourage people to use them. As I say, some hospital trusts do have the information standard, and I've been caught out by saying that, and they say, we've got the information standard, but not many do. So they don't have to go, their patient information doesn't have to go through this very rigorous process that we do. We're assessed every year, and as I say, they really are fantastic. So, our latest activities, let's talk about what we're doing now. Well, Take the Kit. How many of you have seen Take the Kit? Oh, right, quite a few. That's brilliant. Now, this Take the Kit was is the film that cost about £180,000 to make. Most of our films, like our Dr. Doyle films, which are on the website, which are brilliant, cost about a couple of £1,000s to make. They consist of a man with a camera and a member of staff with a board and a doctor talking, done usually in a shopping centre. They're brilliant, people like them, lots of clinics use them. But we wanted to do something different. We'd done a survey of 15 to 25-year-olds who carried adrenaline. The survey covered about 600 youngsters responded to it, and bearing in mind most of them were associated with the Anaphylaxis campaign, so they're what you might call the better informed group. Over a third didn't carry their adrenaline, and a lot of them said they didn't tell their friends. The results were really not what we wanted to read. So we were struggling. How do you communicate with this very difficult, hard to reach group? And I was speaking at the Allergy show in London, and a woman came up to me, and she had a young daughter who was about 9, and she said, would you work with my father? And I thought, well, we'll work with anybody. You know, he might have some money. Yes, we'll work with anybody. And this gentleman came to meet me, and he had worked with Saatchi & Saatchi, and he brought a colleague who'd also worked with Saatchi & Saatchi, and they said, we haven't got any money, shame. However, what we have got are our brains. What's the tricky issue? How can we help? And I said, communicating with young people. And as a result, Take the Kit was conceived. We had to raise £30,000. Everything came free. £150,000 came free through the film companies, people who did Mission Impossible, Paddington, all these things. They all, because of the connections of the gentlemen who were working with us, they raised that support for us. But we had to find £30,000. And because of scheduling, we had 1 month to raise £30,000, which we'd never done before. But with a bit of support from some other charities as well, who advised us, bigger charities who advised us, we actually did crowdfund raising, and we did it. We did it. So the film happened. It was launched. It went viral. We can't calculate how many people have seen it, but it's well over 1 million. Australia use it, but they changed the strapline to an Australian accent and said, contact Anaphylaxis Australia. America use it, Canada use it, New Zealand use it. It's been fantastic. A lot of the clinics now use it with patients that they find difficult to communicate with or to impress. And we thought we were going to get a lot of complaints. I was warned by one of the big charities who'd made a very hard-hitting film that they got quite a backlash. So we prepared for that and had some crisis management training within the organisation, just in case. We had 2 complaints, just 2, and they were quite muted, and we've not had any more than that. Now, I'm hoping we can show Take the Kit. I don't know if it's linked into this. If not, could we show it at the end? Would that be okay? Is it there? Let's have a look. No. We can show it at the end, because I wouldn't want you to leave without seeing, oh, what have I done here? Without seeing Take the Kit, because we are just so proud of that film. We work on, moving on, another area of work we're very involved with is work on thresholds and reference doses. If there's one steady stream that comes through to our helpline and as an inquiry when we're out and about, it's how people who are affected by severe allergies hate precautionary labelling. We know there's at least 43 ways of saying may contain, and companies use different ways, different words, Some of you may be familiar with the Australian system Vital, which has moved on a bit and actually set thresholds, and there's an awful lot of work taking place around thresholds. We actually did an international survey of 30 countries through IFAR, because even though the science is racing ahead, the medics are racing ahead, we kept saying as patient groups, you've got to keep the patients with you. They've got to understand or it won't work. And we did an international survey really just to prove that. And sure enough, across all the countries, the results were the same, that people were not happy with the concept of thresholds, because as clinicians know, when someone's allergic, they're the most allergic person in the world. So there is really a lot of work to do on that. We're now doing, we did a survey on attitudes to precautionary labelling, and again, same feedback. What came through, and this has been verified by other studies that have been done, is that people make a risk assessment based on nonsense. So if something says made on a line, made in a factory, made on a Wednesday, may contain, they make a judgment as to what is the safest, and there's no scientific basis for that. So hence the importance of the work on thresholds. We're part of IFAM, as I mentioned. Also, I'm part of ILSI, expert group on severity versus dose, and Hazel Gowland, who's speaking later and at the back of the room, is also part of that group. I have to say, some of the discussion is totally beyond me, though I attend those meetings, very scientific. However, what's so brilliant is that they are very keen to get the basic patient input into that work, and that's why we're there, and that's very much appreciated. Spreading knowledge on the European food regulations. We've had all sorts of articles and educating the allergic population. Still an awful lot of work to do, particularly in the food service industry, and that's something we're looking at the moment. Our new focused campaigns. I mentioned at the beginning of the talk that we're actually going back to being a campaigning organisation. Our first big push was to get everybody who requires adrenaline, and not everybody does need to be prescribed adrenaline, has 2 available to them at any one time. Now that position's endorsed by the European body, by the MHRA, we feel that battle's won, except that we still get telephone calls and contacts through our helpline where people are being prescribed 1 pen, even children. So even though the diktats are out there that 2 should be prescribed, people should have 2 at any one time, a number of prescribers, particularly in primary care, I have to say, are not following that through. So there's still a bit of work to do, but that was a very important campaign for us. Generic auto-injectors in schools. This has been a very slow-burning campaign, but we think that the law will ultimately be changed, and by next April, keeping everything crossed, this will have moved forward. We're pushing at an open door because this already happens in North America, it happens in parts of Australia, New Zealand, so it's not a groundbreaker for us, but we've learned a lot from what's happened in other countries, and it's fantastic to see that this campaign will reach fruition. We know that a lot of independent schools, for example, already do this because they have clinicians on site, but for state schools it hasn't been possible. A byproduct of this campaign, which is absolutely brilliant, is that the Department of Health have insisted that when this project reaches fruition and the law is changed, all schools have to have adequate training. That's fantastic, because we know training across schools can be a bit patchy, and this, when the law changes, the training will be a key element. Absolutely fantastic. Then we have our AIM campaign, which I'll talk a little bit about in a minute, and also prescription charges. This is a bigger campaign which is very important to some charities and affects them perhaps a bit more than us, to try and get people with chronic ailments not to have to pay prescription charges. If you're children, and there are various other exemptions, but an awful lot of people still do have to pay a lot of money. So we've been part of that campaign. So the AIM campaign, this has been our big push this year. And what happened was there was a young girl, and she was 19. She was asthmatic, but and she had food allergy, but she, apart from when she was very young, she'd been prescribed adrenaline, but that had fallen off. Her current clinician in primary care was not prescribing adrenaline. She was out and about, she did some exercise, she didn't read the label, and labels can be quite difficult to read, and we know, that sometimes people don't always read them in the right way. She took a bite of something which contained nut, and she died. She had no rescue medication. So we worked closely with the family, who raised an awful lot of money for us in our terms. And they were very keen to work with us, and they wanted us to do a campaign to work with primary care, to work with GPs. Quite a difficult thing to do, but because we had resource available to us, we were able to do it in a very professional, measured way. We got an excellent project manager in. Andy Clark worked very closely with us. We had a team of GPs working with us as well. Absolutely fantastic. And we launched that campaign on the 24th of March. Funny day to do it, the day before Good Friday, but we did it then because the NICE standards for food allergy and anaphylaxis were launched on that day. So we had a bit of a hook. NICE worked with us as well, which was fantastic. And as a consequence of that campaign, which is really to give basic education, communication to GPs around food allergy and anaphylaxis, we produced leaflets, we produced brochures, we produced posters, and with the assistance of MEDA and ALK, two of the adrenaline companies, they have helped us enormously to distribute those that basic information across to all GPs. There are 44,000 GPs. That's the number that was quoted to me. So it's an awful lot of GPs, but we're trying to get that information out. Part 2 of the AIM project is going to take place in July. And what that will consist of is going out to all the local radio company stations, to all the local press, as well as the national press, just to highlight to people, if you have asthma and you have food allergy, or if you have allergies, make sure that you seek support. And go along to your GP, and this is the sort of thing you should expect. So that campaign is launching hopefully in July. As I say, quite a major piece of work which wouldn't have been possible without that in memoriam funding. And this is just shows you some of the information that we've produced, and it's all available out in the dining room when you go and have lunch, so do take a look at it. We're really very, very proud of this stuff, very, very proud of it. So how can we work with you? How can we work with you? That's just so important. I always say that the healthcare professionals are our ambassadors, because it's you who refer the individuals and patients and their families to us. Well, as I say, we've got the best information. I'd say that without reservation, because it's written by the top experts, it's gone through the information standard, it's all clinically based. You can trust our information. We give you e-newsletters as professional members, and I know a lot of work goes into sifting through. Moira and Lisa get hundreds of items in a week that come through with regard to research papers, etc. And we, Moira and Lisa, sift through that, and then working with the comms team, we get that information out. So that's really important. Updates on the latest research, and there's some very interesting and controversial research that's coming out at the moment. And we have to keep on top of it, because that's part of our role. And so if you want to use us, rather than using your time to do that, that's what we're there for. The product alerts, which I've talked about, support to your patients. I remember I spent 30 years in the NHS, and I went on lots and lots of NHS training courses. And I can remember they used to say that people took in roughly 11% of what you said to them. That may have changed now, but I hope you've taken in more than 11% of what I've said to you today. But patients can be in clinic, have superb support from their clinician, from the allergy nurse, from the dietitian, and they leave and then they ring us. And you'd think they hadn't been told very much at all. We're there to give that support. We've got the time, we can do it in a one-to-one way, we can point them to resources to help them. So, and also people ring us just because they're frightened and nervous and worried, and they've been shown how to use their adrenaline, for example, but they're still not quite sure. So again, that's very important for us. Free conferences, like today, we have 2 conferences for healthcare professionals. We've got another one later on in the year in London for healthcare professionals, and we think these are really, really important, that we bring top speakers to our professional members. Allergy-wise courses, and as professional members get those at a reduced rate. And as I mentioned, some of the courses are now freely available. Research grants, and our ideas are still developing. I mentioned to you, we're putting our foot in the water now with regard to doing webinars, which is quite a new thing for us. You'll notice today this conference is being filmed and will be streamed out again. Quite a new development for us, and we're learning all the time. So I'd just like to thank you all for being here today, and thank you for your ongoing support. Oh, golly, I nearly forgot. I would never be forgiven. Orange Wig Day. If you look on your seats, some of you will find you've got some lovely orange wigs. If I can borrow that one. These are gorgeous, and on the 20th of May I want to know that you are all going to have one on your heads. About 4 years ago, somebody in the office, I think it was Carrie, our fundraising manager, had a wonderful idea. She said, why don't we just make a special day where people can do something daft and it'll raise awareness. So she came up with the orange wig idea. We sent a couple out and it was a success. Last year we sent out, I think, 1,500 wigs, something like that, and we raised an awful lot of money. So this year we want the same thing. All you have to do is put it on your head, take a picture and send it to us, and we will tweet the picture. They go on Facebook. We use some of them in our magazines. Lots of clinics do it now. We're encouraging clinics increasingly to do it because it raises awareness. It's a bonding thing. If you see your consultant bobbing around in an orange wig, that's quite funny. But schools and nurseries do it, individuals do it, and it's been a huge success. We get these wigs from somewhere in China at great expense. And I think it was this year we had trouble. They were held up at the port in Southampton because people wondered what they were. So do make sure you wear these orange wigs. Nobody will be allowed to leave this conference with that one. Hooray!
Okay.
Yeah.
So thanks very much. Thanks very much, Lynne, for a really... It's quite nice, actually. I like it. For quite a really comprehensive, broad-ranging talk. I think you'd agree there's something there that we can all give our patients, each and every one of us. I'm particularly, really have to remember about the hook of the free allergy-wise training for patients if they register and pay membership for Anaphylaxis campaign. That's really helpful. That's something we can all do. And we can all think about ways that we can improve allergy services locally as well by, training groups and support groups. But really, I think the message is tap into the hub that is the Anaphylaxis campaign, because there's such a rich energy there and such good quality information that comes from it that I think we should all make the most of it. So thank you very much, Lynne.
Thank you.